Thanks for doing this, Mike.
Yeah.
I really appreciate it.
Okay, you guys ready?
Yep.
Here we go. You're listening to Pastors at the Mic, a podcast by the pastors at Creekside Community Church.
Get on my secret signals.
Well, welcome to a special episode of Pastors at the Mic. My name is Michael Roop, and I co-host, as always, with lead pastor Steve Gregg. Steve, how you doing tonight?
I'm doing great.
Man, it is good to be together. We are recording this episode with a live YouTube audience because we are joined once again by infectious disease expert and Creekside elder Mike Lauzardo to check on the world of COVID. We hope you enjoy the conversation. All right, so for the three people watching who don't know who Mike Lauzardo is at this point, Mike, we're so glad you're with us. Mike is the Deputy Director of the Emerging Pathogens Institute at the University of Florida and the Associate Professor of Infectious Disease and Global Medicine at the UF College of Medicine. And for the last year, Mike has been running the Screen, Test, and Protect program at UF Health and is now up to his arms in vaccines.
Whoa.
See what I did there, Steve?
There you go. Good dad joke.
Mike, I have no idea where you found the time to be with us today, but thank you for coming to be with us tonight.
No, thanks for having me. And again, it's a privilege and honor to be here again with you guys. So thank you.
Yeah, so Steve, I was talking to Mike about this earlier. He's the first 3-time guest on Pastors at the Mic.
Wow.
So he's arrived in his career.
He has arrived. So
Yeah.
we'll start keeping track of that like Saturday Night Live. You get like a medal at 5 times or something like that.
Yeah, don't take this the wrong way, but I'd like to start winding this down.
No, it sounds good. You never have to have me back to talk about COVID.
We could just have you on to talk about other things.
Other things. That'd be good.
That would be
Absolutely.
great.
Like hobbies that you used to have or things like that.
That's right.
Yeah.
That has
So,
died off.
but we're not here to talk about that, Mike. Before we dive into some of our maybe more specific questions, just broadly speaking, what is the state of the union on COVID right now?
You know, I think the bottom line is that the news is good at the moment. I mean, I think there's a lot to be excited about. I think most of us that are involved with COVID control and kind of dealing with COVID are just very encouraged right now. The decrease in cases that started about 7-8 weeks ago has continued. It's been a global sort of phenomena, but really what we're seeing is that it's the numbers are dropping nationally and then also throughout Florida and particularly locally as well. To kind of put this into context a little bit, the cases in Alachua County, for example, have dropped about 6-7-fold since the first week in January when we kind of peaked in the number of cases. And the numbers of cases on campus have dropped about 10-fold. From the time that we started following cases in the early part of this year. And so this is all very, very encouraging. Yeah. We test about 2,000 students every day as part of our routine surveillance and do about 15,000 or so tests per week. And our positivity rate now has been consistently below 1%.
Wow.
Which has been fantastic to see. And actually, we've dipped below 0.5% here for the last couple of weeks or so. So all very encouraging. In terms of hospitalization, we're seeing at UF Health, again, a phenomenon that we're seeing across the country as well, where the number of hospitalized patients continues to go down. And all this is really sort of lifted up by the fact that we're really amping up vaccinations. So again, vaccines don't matter, but vaccinations do. So getting those vaccines into people's arms is really starting to happen, where right now in Alachua County, 70+% of people 65 and older have been vaccinated. And in certain hard-to-reach communities, that number is actually 80%. So we're continuing to make a lot of progress there. Over 20%, or about 20% of Alachua County residents who are eligible to get the vaccine have been vaccinated. So it's encouraging. So we're heading in the right direction. Now is the time to keep pressing and to keep moving forward. So again, an encouraging time, the first sort of bright lights that we've been seeing for a while in terms of some positivity. So we're definitely encouraged, and it's coming at a good time.
Yeah.
Mike, one of the things I've heard back from some of my friends who are pastors in East Gainesville, pastors of predominantly black churches, they've really appreciated you and your availability to them. And I know that you've been over in that part of town, folks from UF doing vaccinations. Is that going well in the black community? And it seems like the black churches and these communities are really leading the way in that, which is exciting to see.
They are. And, I think as I always like to tell my staff that work with me is that they get tired of hearing this, is that I always say that there's no such thing as a project or a program. There's just relationships.
Yeah.
So again, I think the relationships that we had through the Alachua County Christian Pastors Association, tapping into that very early on, working with them, they're fellow believers. And so connecting early on really helped. And now when it came time to reach those communities, the relationships that we have with them them, and the fact that they're trusted in their community. The pastors are trusted, the churches are trusted, and people trust people in places.
Yeah.
They want to go to places that they're familiar with, places that are close to them, that are part of their neighborhoods. And they want to trust people. And the pastors on that side of town, and as pastors virtually everywhere, are going to be trusted members of their communities. And that has really helped us move forward. So we just tapped into networks and connections there, and really just not so much trying to convince people that they need to get the vaccine, but just present them with fair and straightforward information and facts, and then empower them to make informed decisions for themselves. And it's gone really, really well. A lot of enthusiasm for being vaccinated, a lot of people getting moved through and giving access to the vaccine. So it's wonderful.
Well, and I know for them, the fact that you are a churchgoer, you're a follower of Christ, I know that's carried a lot of weight as they go to their churches then and say, hey, we've got somebody to come speak to you. And so you're just not, you're able to speak the same language, and, you pray with them. And so I just know your faith background has been a real help in reaching that community. In other places, I think maybe it's been a little more difficult to get into. So thanks so much for leading in that and your example in that. I'm just encouraged.
I appreciate that. And again, there's a lot of people that are behind that and kind of help. I think what I've really kind of felt is just that, yes, there are places where science and faith don't necessarily see eye to eye, let's say.
Sure.
But I always kind of say that there's much of that is unfortunate, because I think that in many ways science is God's language, right?
Yeah.
So this is his language of creation, and at least that's how I try to explain it. And there shouldn't be as much conflict as there is. Yeah. And again, in the day and time in which we live, there's sort of these different camps. If you're on this side of that, but really, it shouldn't be that way. And I think that bridging that gap is not as difficult as it sounds. And clearly there are some things, because they answer very different questions. But I see science as a gift from God, a blessing, and something that we're to use to move forward in His grace and kind of show what the kingdom will be like, and that we have the ability to do these things and kind of pass those along, to care for one another in that way. So apply the tools that we've got, and science is one of the tools that He's given us. And so I don't see that big divide as much. It's not as much of a conflict as I think it comes across as.
I appreciate that. That's a good word. I want to obviously ask, I've got a lot of questions about the vaccine that have been pouring in the last couple of days and even now, but just before we get to that, I have a couple travel related questions that have come in. One is somebody who travels internationally and is asking, are there locations in the Gainesville area that provide guaranteed 72-hour turnaround or less for PCR testing, and so needing to have those negative tests in order to travel internationally?
Yeah, so a good question. I don't want to speak for what other, kind of the travel requirements, because the travel requirements are very particular, and it depends on where you're going and what purpose you're going there for. In terms of having a guarantee, most places now, depending on the volume and the surge, where the case number is lower, getting a turnaround test of a PCR test within 72 hours is a pretty reasonable thing to be able to get done. We've been able to do that through UF Health pretty consistently. So through our labs, that turnaround time happens. There are always challenges with that in other labs and in other settings. So I don't want to say this lab versus that lab not being able to in this, because I don't really know about their turnaround times all the time. But in general, with the decreased sort of number of cases, there's a little bit less demand, fewer people getting tested because they have symptoms, and fewer spread at the moment. So getting those tests within 72 hours is pretty doable. Okay. So it is happening, but again, there are challenges, and you've got to read the fine print in terms of where you're going and how you're going, in terms of making sure you got the right test before you travel.
Another question related to travel is I hate to use the word prediction.
Yeah.
This is going to happen several times tonight, so I'll be good with it. Any prediction on when the U.S. might lift travel restrictions for people returning to the United States? So right now, the U.S. requires a negative COVID test before returning to the U.S. Are we waiting for the number of cases worldwide to drop before they lift that requirement? Yeah,
so I can't speak to what the State Department will or will not do in terms of those requirements, but I think that that's probably going to be a requirement that's going to stick around for a long time. The reason being is that one of the largest vaccine efforts in the world is happening here in the U.S. The vast majority of the other almost 8 billion people in the world do not have access to vaccine. And so their coming back to quote unquote normal is going to take a long time. So Europe has access, Brazil has some access, scattered throughout Latin America. Much of Asia does not, except for China. So in other words, the broad sort of spread of vaccine coverage and returning to normal globally is going to take some time. And if other variants and other things are out there roaming around, I think the idea of lifting that testing requirement before coming to the U.S. is probably going to be a while before it gets lifted. Again, I've been humbled by this virus, and a lot of my predictions are dead wrong. I think it's a challenge in many ways, but my gut feeling is that this is probably something that's going to stick around for the rest of the calendar year and may roll into 2022 as far as the testing requirement to come back in. Again, it depends on a number of different factors, and this is going to be mostly for international travel. And so we'll see what the testing requirements end up being. And again, the role of being fully vaccinated, if that will impact your need to be tested or not, that's something too that will evolve over time as we get more science.
Gotcha. Steve, I want to throw it over to you, but just a reminder, if you're watching on our live stream, drop in your questions either in the chat box or towards the top of the chat box, and at the bottom of your screen, we've got a number. If you'd rather text your question in, I'll get it right here and pass it on to Dr. Mike.
You were talking about travel, so I'll stay with that for right now. So I'd heard something on the radio today about there's hopes that maybe there would be room for camps this summer and things like that. I mean, what's your thought on those kind of things? If there's people watching that are thinking about camps or VBS or things like that, gatherings in the summer, what do you expect restrictions will be, or guidelines will be?
I'm encouraged. So again, I kind of get accused at work of being very optimistic, and I think that's a good thing. I'll wear that happily,
Sure.
but it's what I call bounded optimism, right?
Okay.
So in other words, I think that we will be able to do a lot of things this summer that we were not able to do last summer.
Right.
But it's going to depend a lot on how well we do at vaccinating people who are not just the vulnerable, but other people without risk factors. So in other words, we've got to head towards getting more people vaccinated who are the spreaders, people in their 20s, 30s, and 40s who may not be particularly vulnerable to getting COVID or becoming very ill with it, but who serve as kind of the spreaders. So in other words, that's the community, and that's the group of people that we need to have take up the vaccine, not just for their protection, but for the community. If we get good coverage and it starts to reflect in decreasing rates because of vaccination, right? So the drops that we've seen, ironically, have not been because we've been vaccinating a lot of people. The drops that we've seen have been for other reasons that had to do the high spike, a lot of infected people over the holidays, and then we've come back down, and now we're probably going to level off soon. But if we can vaccinate a lot of people and the numbers go down, we'll be able to do more. I anticipate that we're not going to have really big surges like we've experienced over the holidays, then in the previous to that in the fall and the summer before that. I think we'll probably plateau here at a kind of a lower basal rate where it just kind of pops.
Yeah.
But if we vaccinate those that are at greater risk, then we'll be able to do more. So to give you an idea in practical terms, on campus, we are now reviewing all the policies for, I don't know how many, it's like 100 plus different camps that UF does.
Right.
And we're allowing a lot of things that we didn't before with certain requirements. So in other words, outdoors, you'll be able to do more. Physical distancing will start being lifted to some extent. Masking, we're taking into account vaccination rates, taking into account indoors versus outdoors, taking into account what activities they're actually doing.
Right.
So something indoors might be a little bit, quote unquote, more risky than something outdoors. Depending on the age groups will vary as well. So there's a lot of things to take into account, which is a very long-winded answer for saying I think a lot more normal things are going to start happening, but we have to be thoughtful as we start to open things up, because it's not the time to do it just yet, but we have to start planning for what things will look like in the summer as we start to ease back into normal. If we handle March and April well in terms of vaccinations, we'll start easing back to normal over the summer.
So not time to take your foot off the gas or the things you're doing. I mean, but make these changes slowly, and really thing is getting a wider group of people vaccinated.
That's correct, because things change as you get vaccinated. You're afforded a certain degree of protection.
Yeah.
A lot of the concerns that we had are starting to kind of fade as we get more information, more experience, and kind of moving. So it lets us move more confidently in the right direction. But at this time, again, you fight until the bell rings.
Right.
And there's still a lot of fight left, but this is a critical part for us to just finish strong, because otherwise, if we don't do it right, and again, this is the optimist in me still speaking, if we don't do it right, we're wearing masks for a very long time, and we're still fighting this and kind of just will not get out of this cycle if we don't get vaccines and don't get ourselves immune.
And getting it right is getting enough people vaccinated.
Correct.
Okay.
And not just focusing on the vulnerable, because that's not who spreads it. Who spreads it are going to be more healthy, mobile people that care for some of those folks, that interact with them, that are part of the community. So 20s, 30s, and 40s, people in their 20s, 30s, and 40s account for almost 3/4 of all the spread.
Wow.
And so really right now we've been preventing people from dying and getting admitted to the hospital in late March and early April. So that's when you'll see the impact of what we've done. But in terms of spread, we haven't really hit the source yet, and that's going to happen here soon.
Okay, that's great.
So let's dive into the vaccine, which obviously will be the bulk of the rest of our conversation. So just briefly, who is currently eligible to receive the vaccine in Alachua County?
It's a very good question because I think it varies quite a bit and it kind of hits a lot of different things. So there was a new executive order that went into effect, that will go into effect on March 15th, which will drop the age from 60 and above. Anybody who's 60 and older will be eligible to sign up for the vaccine. It has sworn law enforcement, 50 and older, firefighters, I believe, 50 and older, K through 12 educators, and that is 50 and older, but that has changed to allow some that are not 50 and older. So that number has changed. It also varies if you go to a federal site or a state site, and that's created some other confusion because if you go to, say, the FEMA site in Jacksonville, they're vaccinating almost anybody. And similarly in Orlando, the standards are a little bit different. So it depends on where you are, but from the governor's order as it exists today, it's 65 and older. And then there's the more nebulous category, which is if you are determined to be highly vulnerable by your physician, you are eligible to be vaccinated. And you have to present a form from the Florida Department of Health, signed by a physician, filled out in hand, that cannot be done by a nurse or an extender. So that's kind of created some challenges for some folks, and that form is only required at health department sites or state sites. Mm-hmm. It is not required at hospital system administered sites, which don't need that form. And then also there is some word that, from what I've heard, is that Publix and CVS and some of the retail sites are federal and some of the retail sites are state, to create more confusion. So again, you're kind of getting a theme here that there's a lot of confusion that's there. And on top of that, it's understandable why so many folks are confused, because there were all these other things that came out before vaccines were available that were talking about different priority groups. So when is my priority group going to come up? I'm a 7B because I do with the general public and I'm an essential worker. All these things really created this expectation that there's some sort of magic priority list that is out there. There isn't. And so that is not how this is kind of rolling out. So a lot of confusion is created. My own personal opinion is that now's the time to open it up to everyone, and that if people have risk factors, they should go sooner rather than later. If those that don't have risk factors can wait a bit and then get it, plan to get it as well, that'll help us move this along as quickly as we can and get as many people vaccinated efficiently. When you create a lot of these criteria, people are confused. Yeah. Here I am, this is all I do, and I have to check daily to figure out what the requirements are and interpret what those requirements are. Think about it at a vaccine site where you're trying to figure out who's eligible and who's not. And what you get is the most dangerous thing, in my opinion, in terms of this stage, is that you have an empty chair. You have an empty vaccine appointment slot. You cannot get somebody vaccinated, and you got to vaccinate that person at some point. So what you do is you put it off till later because you don't have the criteria or whatever the requirements are. So again, we follow the governor's executive orders to a T. However, there are some challenges with that, because what ends up happening is that you have empty appointment slots. And when that happens, you delay things and you have people lose trust in the process. So I think there's some kinks that need to be worked out. I think it'll happen. I think we'll get moving a lot smoother. I think the vaccine sites have figured out how to do massive numbers. I think we figured out how to staff them. I think we've, dealing with a lot of the vaccine questions that are out there. Now I think it's just a matter of the criteria, but that too, as the vaccine supply gets better, that those issues will start to go in. There'll be less of a desire and less of a need to kind of limit who ends up getting vaccines and who doesn't.
Okay. Appreciate you. I was expecting it to be a short answer, but it turns out no. I mean, it's what you gave is the right information, but it just turns out it's a very complicated system right now. I appreciate that information. So one of the questions I'm getting a lot here on my text threads is, are there any, I'll just summarize, are there any vaccines that are better than others? Are there any that come with less side effects? And do we have any knowledge of like longer term side effects with these vaccines?
Yeah, these are all really good questions, and I think they're very important. So in terms of the vaccines that are out there, there are 3 that are approved but they're called emergency use authorization, and so they're approved for use in the United States during the pandemic. And these are made by Pfizer, Moderna, and now Johnson & Johnson. They came out in that order: Pfizer, and then a week later Moderna, and then Johnson & Johnson. Both Moderna and Pfizer, when they came out, they had astronomically good data in terms of the efficacy, in other words, how effective they were, where they were listed as 95+%. So that got everybody's attention, because when the effort to create the vaccines first came out, the thought was, well, we'll be lucky if we get something that's 50% or more effective, because the flu vaccine, if it's 50%, we're thinking it's a pretty good year. And we'll take something that's 30, 40% effective as well. And there is an impact from that. These were 95%. And then lo and behold, when Johnson & Johnson came out, it had a lower efficacy. In some places it was as low as 66%, but others as high as 81%. So there was some variability there. It's important to remember that there's really, at this point, no clear evidence that one is better than another. Now you're saying, Mike, you just said 66% versus 95%. Well, those studies were not done in the same populations and weren't done at the same time. And that's important to remember. And then also remember that the way we consider a vaccine a failure or a failed vaccine event is if you get any symptoms and you're test positive later on. And so that means if you even got a runny nose and you test positive, that vaccine failed. But what you didn't get is that you didn't get hospitalized and you didn't die.
Right.
And this is one thing that's real important, is that if those studies were done at the same time, you would be comparing apples to apples, and you can't say one over the other. So in terms of side effects, the two-dose bit is the challenge that you have with Moderna and Pfizer. You have to get 2 doses for it to be fully effective, at least based on what we know now. Johnson & Johnson is 1 dose. But in terms of side effects, there's no clear winner over which one over the other. There are side effects in terms of local things where you get arm soreness and a little sort of kind of muscle achy feeling that you get. That's the most common and pretty common that happens. But really, as far as like severe side effects, much less than you get with other vaccines as well.
Okay.
But in terms of the efficacy or the effectiveness, the important thing to remember is that during these clinical trials of these vaccines, nobody who got the vaccine died from COVID. And that's compared to the group that got the placebo shot that did get COVID, and people died when they didn't get the vaccine. So when you look at the thing that really matters, at the end of the day, what we're trying to do here is stop human suffering and death. And if you're able to just sort of make this virus just another common cold and weaken it, and that's considered a failure, well then, hallelujah, we're in a good spot. So again, you're preventing death and preventing serious hospitalization, and this is where all the vaccines that are being tested in the U.S. and being used in the U.S. performed amazingly well. And that's an important thing to remember.
That's really cool. One of the things, and I don't know, we're in the program, we go here, so I'm just going to go here. So one of the things Mike and I get is videos or articles that from Christians who are concerned because they've seen a YouTube video or something like that says the vaccine is being made from aborted fetuses or things like that. What would you say to those folks that are afraid that somehow taking this vaccine is an immoral thing?
Yeah, so that's actually a more complicated question, I think, to answer. And I think there are some simple answers to kind of come up front, but I think that there are some legitimate concerns that as a Bible-believing Christian believer who believes in the sanctity of human life from the time of conception, there are things that people need to be aware of as they make decisions and make informed decisions about the vaccine. So first of all, with regard to that, there is no fetal tissue included in the vaccines. No abortions were done to make the vaccines or to test them or to use them in any way, shape, or form. And there is no fetal tissue or anything related to human remains or anything in the vaccines, any of them. For the mRNA, for Pfizer and Moderna, there is no use of cell lines that came from aborted fetuses at all. With the Johnson & Johnson vaccine, that is an adenovirus vaccine. So what that is that we use an adenovirus, which is a virus that causes the common cold symptoms, and it gets inactivated to where it doesn't work. And then we use that virus to be able to carry genetic material within it so that your body can recognize and make the protein that protects you against COVID infection. And so that process of making that virus, the way the adenovirus vaccines work is that they use cells that came originally thousands of times, thousands of generations of cell lines that came many years after a cell that was originally obtained from an aborted fetus in the 1970s.
Okay.
And so they use that cell line to make these adenovirus vaccines. So there's nothing connected to the fetus at that time, to the unborn child that was aborted at that time, to which that cell line originated from. It would be many ways like blood from somebody who was was executed or murdered or died in an accident, and that those cells from that blood were continued to be propagated and then used. So again, I think for those of us who believe in the sanctity of life, it creates sort of a complicated question in terms of the adenovirus vaccine, where, and I understand the challenge that can pose for people. I think it's important to get factual information about that and kind of where that is to make an informed decision. For me, my personal decision is that I don't think that this in any way undermines my belief in the sanctity of life. I don't believe that in any way we, by using the Johnson & Johnson vaccine or adenovirus vaccines for that matter, means that we support abortion in any way, that it doesn't undermine our argument. It isn't where we're benefiting from an abortion practice. It is complicated and it is difficult to sort of give an easy answer. And I think if we're honest with ourselves, it's, you've got to kind of struggle and think through this. But where I've landed on this is that I think that it is far enough removed morally and ethically, and from the practice of abortion to where it's in this setting, I think it's appropriate to be able to use those vaccines. But again, the challenge that many believers will have, and people who are believe in the sanctity of life, will fall on both sides of this issue. There are other options for people that want to not kind of use a vaccine that had used any connection at all to cell lines that came from an aborted child. But those cell lines are so far removed that there was nothing connected, nothing supporting abortion now. There's no abortion necessary to have these vaccines developed. And so I think that's an important thing for us to consider. But again, the difficult decision that's there, you contrast that with all the other things that come from this setting. So I think it's a challenge. Now, again, we're not. Most of us who are on this, I don't know who's might be listening outside who may be Catholic, but the Vatican actually made a very deliberate statement addressing this issue, and said clearly that they felt that there was, again, it's for individual believers to determine, but that overall the Vatican came down pretty strong on the side of that there's no moral or ethical sort of indication to going ahead and getting vaccinated with the Johnson & Johnson or any of the vaccines for that matter. So it is in my opinion, it is a serious issue and something to consider. Also get to think about the source. So I haven't seen those videos and kind of the context in which it's being conveyed. Usually there's another message there besides giving people the science and kind of getting them into a certain direction. And again, I'm sensitive and want to show grace to understanding different points of view where believers will fall in different stances here. But I think it's important to be informed and to make good decisions about where we are and to kind of look at the grand scheme of things. And again, in trying to think of what my answer might be to a question like this is just recognizing also we're in a fallen world. And there are probably countless things like this that kind of go on that we are part of living in a fallen world. And I think that the approach that I try to take is to try to be light and salt in that fallen world as best as I can, with knowing that that same fallenness, if you will, and brokenness is within me. And so I want to try to show as much grace and understanding as I can as I try to alleviate as much suffering as I can, and to fight for the sanctity of life in ways other than not getting vaccinated, because I think that I can hold that position and still not use this as to be the quote unquote the hill to die on. But that's, again, I respect those who may feel differently, but I want people to have an informed decision related to that.
And that's helpful because I think the impression with some folks is that these are aborted fetuses recently, that
No.
there's some kind of harvesting or
No,
something like
it's
that.
it was from 1973 and I think 1981.
Okay.
There were 2 cell lines that were used, and I think they were back from 40 and 50 years ago.
Okay.
And
That's
it was from one aborted child.
Okay.
And I think just pastorally, and Steve, feel free to jump in on this, but I think this is an important opportunity to talk about, 2 things. Number one, Mike, as you said, I think really well, that we have to acknowledge there's a sufficient complexity to this to where Bible-believing, Jesus-loving, committed Christians are going to potentially come to different conclusions on the morality of these things, but we need to have the humility to respect. This is not a cut and dry issue, and I think that I think it's presented that way. And again, Mike, I think as you said really well, often by people who have a different motive than speaking the science very clearly. And so I would say one of the things we need to do is we need to have humility and grace for people who think through this and pray through this and honestly come to a different conclusion than we come to. And the second thing I would say is, this is important in all sorts of arenas, but COVID is helping us experience how dangerous it is we've really got to be considering the sources of our information. And I think that based on the videos that have been sent to me, there's a theme of we think when somebody is banned from YouTube, therefore they must be telling the truth, or therefore there must be something that the system is trying to hide from us by banning these people from YouTube, and or banning from whatever. This person got fired, this person got silenced, or whatever. And it's therefore they're telling the truth. That's the only explanation for why that would happen to them. And I think we need to, and I'll just speak to this as a pastor to my people, and if you're watching, you're not a Creeksider, then just take it for what it is. But I think that we have to be a lot more selective and careful than that, and a lot more smart than that. I don't think that there's any evidence that there's a massive conspiracy out there to use this virus to accomplish whatever it is we're being told is trying to be accomplished, whether it's put GPSs in our arm or to keep us living in fear or whatever it might be. And so, listen, I'm just trying to say we need to consider the source of information, and we need to think very carefully about who we're listening to. And Mike, I'll just say, one of the things that has been a ballast for me is I've served as an elder with you for multiple years. I know your character. And so if I'm going to get an email and somebody's going to say, hey, this doctor from over here says something about the mask, how masks don't work or how vaccines or whatever, and I'm going to be like, well, I don't know that doctor, but I know Mike. Right. And I know him as an elder in my church and as a man who loves Jesus and a man who's a good doctor and is committed to science. And so you're a source I trust, and I'm checking this stuff against you all the time. You're probably like, maybe a little bit too much. But I do think we need to really, and this is going to be true much more broadly than COVID as well, is a lot of what's plaguing us, and not to take us down this rabbit hole because I'll get back to vaccines after this, is we've got to consider the source a lot more than we are. Just because something's published on the internet doesn't mean it's vetted and true, and just because somebody has been banned doesn't mean it's because they're telling the truth.
So I told my wife many years ago, we were sitting talking, and she was, let's just say, getting excited about something. And I said, so what's going on? She said, I'm reading this article and I'm looking at the comment section. And she's reading the comment sections, and there were just these crazy things being said. And again, the only requirement to write at the comment section at the end of a newspaper article is you got to have just an internet connection, and it can be anybody. And I said, why are you letting that person kind of ruin your day? I mean, that's kind of like walking down the street, picking up gum off the sidewalk and chewing it. You would never do that. Yeah. You don't know where that came from. You don't know anything about it. And yet, again, in this day and age, if you have a camera and you've got a video and you've got something, and again, maybe they do have some kind of medical background, but that doesn't mean they're an expert in this. It doesn't, I mean, there's all kinds of things. And so just as a pastor, I would amen what Mike just said. Please be careful about where you get your resources and and stuff gets passed around. And again, same thing, Mike, I've known you for decades. And so, and it's not just your integrity, but the kind of doctor you are and your reputation and how thoughtful you are about stuff. So yeah, it's been really, you've been a great resource for us, and I know for a lot of folks in town, so thanks.
Yeah. So off of our soapboxes now, Steve, Greg, we can't be helped because somebody put a microphone in front of us. So
exactly.
So Mike Lauzardo, a lot of concern about the speed at which these vaccines were produced and approved for the population. Are there any concerns about that process, and what level of certainty can we have that these are safe versus some of the other vaccines or medications that have a much longer runway to approval?
Yeah, so it's a great question and obviously a very important concern. And I'll be honest, I shared those concerns when I heard about the timeline and kind of the thought of moving forward. But after I really looked at it and kind of looked at the data, talked to colleagues who had looked at the data, talked to people who were actually involved in some of the design of those studies, my fears were put to rest, and just let's take it at face value. This was really good news and an amazing achievement to be able to get these vaccines as quickly as we did. So why did it happen as quickly as it did? Well, there are a bunch of reasons. The first one is that this was probably the largest single scientific effort concerted at one problem at one time in the history of mankind. There were literally thousands of different laboratories working in some capacity on developing these vaccines, and there was already a lot of effort going forward with developing vaccines for different pathogens or different viruses or other germs that cause human illness. And so that whole effort was focused on one spot. Also, a lot of the times when companies do these studies is that they take a huge financial risk. So in other words, they want to be careful about that. So there's a huge cost to be able to put these forward, and so they don't start production until they know that something works. So of the companies that went forward to make things, Merck, their idea failed. And so it didn't work. And so they had to back off, and they were not able to present a vaccine platform or a new vaccine that worked, and so they had to step out. So there was a process by which the federal government supported the development of these vaccines and said, great idea, science looks good, start making it and then test it. And then if it all comes out fine, we'll have a bunch of it ready to go, and then you can go. And the risk to the companies was removed because money was provided by the federal government as a backstop. Mm-hmm. The other thing, too, is one of the limitations with being able to come to new drugs and new vaccines is that you have to have what's called research capacity or clinical trial capacity. That was put in place in huge numbers. And again, the whole world was looking at that. So we had a lot of ability to be able to recruit people at risk for the disease, and they developed the disease quickly enough because it takes time to figure that out. So that was there as well. And then also, let's face it, anybody who's done anything with government regulators before knows about government red tape. It was all eliminated. They just made decisions executively to get rid of a lot of the red tape, but the science was not compromised. So in other words, they still did things to the same standard that they did before, looked at everything at the highest levels. All the different levels we're looking at, all different agencies, all different scientists, independent, those supported by the government, those outside of government, within government, all were looking at it, and the data is solid. And looking at the results of the studies, you just sometimes got to take good news and try not to be as skeptical, because the news looked really good in terms of the outcomes with the clinical trials that were there. So I think most of us have a lot of confidence. After the vaccines were approved, and now that more than, I think, 55 million Americans have been vaccinated so far, what was found in the clinical trials has been proven in the field. And that really is the strongest validation that the science was not compromised in any way. Ongoing studies are being done where there are multiple different ways to be able to monitor what's happened after people have been vaccinated. So we're looking at that. The one sort of black box, if you can say, is right now we don't know the long-term effects because there's not been enough long-term.
Sure.
It's just not been enough time. And the vaccines, this disease has not been around for more than 18 months, and the vaccines have not been around for more than 6 months, even going into clinical trials. I think the first people were enrolled in late July of 2020. So you're just looking at just over 6 months with the earliest people who got the clinical trial vaccines. So I'm very confident, and especially now with the experience that we've had, that these vaccines and the science behind them are solid, they're effective, they're beneficial, and they're the way that we're going to end the pandemic.
Awesome. That's a lot of good news. Thanks. Can I run through a list of some different demographics and ask if there's anybody on this list who should not get vaccinated?
Correct.
Okay.
Go ahead.
Are there any medical conditions or medications
No.
that somebody might be on? If somebody is immunocompromised?
No, they should get vaccinated.
A mother who is breastfeeding or someone trying to get pregnant?
So that's where there's only a little bit of pause there. The recommendation is that those women speak with their physician about the risks versus benefits. The reason why that's the case is because pregnant women, and I believe breastfeeding women as well, were not included in the original studies. I'm not as sure about breastfeeding women, but I know pregnant women were not included in the study. However, a number of women who've been vaccinated were pregnant and didn't know it. And so they're being followed, and so far there's been no adverse effects. I mean, many of those women will start delivering here in the next few months. The first ones will start to deliver, and then we'll get a better idea of kind of if there's any side effects. There's no reason to think that. Many people are hesitant to get this because they hear the word RNA, they think genetic material, they think it's going to alter their ability to have a child or reduce their fertility. I hear that very commonly. There is zero evidence of that at all, and biologically, we have no idea how that could happen. So that's not a concern, and that's not been reported in any of the studies that have been done so far. So breastfeeding women and women who are breastfeeding, and then also wanting to get pregnant, talk it over with your OB. But it is recommended right now that they get it because the risk of COVID during pregnancy is considered worse than the potential damage from a vaccine. So it's, again, balancing those. That's where it is. But again, that's a physician to patient discussion.
And that's just to maybe try to make sure I'm hearing what you're saying. So the pause with breastfeeding and pregnant or hoping to get pregnant is not because there's any science to suggest it is dangerous. But we don't know if it is or not.
Correct. And there's not that definite evidence where we can say of 4,000 women who were pregnant and got this vaccine, none of them had a problem. We can't say that because wasn't done.
You don't have the track record.
We don't have the track record. But in terms of just looking at the balance, the overwhelming number of experts will say that there's less risk getting vaccinated than there is to get COVID while you're pregnant.
Is there, if somebody were given a choice, I hear some people saying, I'm not going to take this one or I'm going to wait for that one. I mean, is there any real benefit from trying to target in on one particular vaccine?
And when people ask me which vaccine you should get, again, there is, if there's some reason to think that it's a group of people that are not going to come back for a second dose, you might think of the Johnson & Johnson over that. I think that for those who, as we discussed earlier, have an issue perhaps with the adenovirus kind of component, that would be one moral and ethical reason for people to consider. But the recommendation that I give to everyone is the vaccine to get is the one you can get tomorrow. So in other words, the one that you can get access to the soonest is the best for you and the best for society as well.
Is Johnson & Johnson in town? Is that one shot available?
Yeah, so that's supposed to be coming in town. It's probably because it's the one shot. And actually the big advantage of it too is that it doesn't require the same refrigeration.
Right.
So it can sit in a regular fridge for 3 months or until the expiration date. And can sit there and then can be used and drawn up individually. So it doesn't have to be kind of managed the way that we manage the mRNA vaccines.
Okay.
Yep.
Couple more groups of questions I got coming in here. Probably the biggest one, length of immunity. So we're hearing some folks are hearing that they may need to go back in 3 months after they get vaccinated to get a booster. Obviously, again, we're early on in this.
Yeah.
But what sort of indications do we have about how long a vaccine is effective?
Yeah, great question. And again, we need to know more to understand how long it'll truly be because it hasn't been enough time. But it is certainly not 3 months. So it's much longer than that. The studies that I've looked at duration in sort of like a laboratory model hinted more towards 2 or 3 years. Most people think that based on our experience with our immunity to other coronaviruses, the 4 human coronaviruses that existed before COVID, in those circumstances, immunity didn't last terribly long, but it looks like it's longer with COVID than it is with some of the other, with the SARS-CoV-2 or the coronavirus. Looks like it's longer. So it's definitely not 3 months. It's more than a year, but it's somewhere probably between 1 to 3 years, maybe even longer. We just have to let more time pass. But it is certainly not, what I've heard some people say, and heard Dr. Google on Facebook say that it's why get the vaccine? It's not really going to protect you, and you just got to get a booster in a few months. That is not true. So right now, what we understand is that the vaccines are very effective. They last for a long time, and the degree of immunity seems to be able to be protective, at least at a year, and that's because we don't have much evidence beyond that, to be able to say. But from laboratory studies, it looks like 2 to 3 years, and then it maybe be beyond that. But we'll just have to wait and see. And remember, the flu shot is a yearly vaccine that we do, and it plays a very big role in keeping people safe and out of the hospital and reducing people from dying.
Yeah, I didn't know Steve's doctor.
Yeah, Dr. Google?
Yeah.
Dr. Google.
Yeah, Dr. Google.
You've been seeing him for a while.
Yeah, I've spent a lot of time with Dr. Google, and
I can only imagine.
He's apparently opened up a clinic on Instagram as well, so that's been very, very helpful.
Brave new world.
Yeah, so it's been good.
Hey, another strand of questions I'm getting, if you saw what I did there, is about some of the variants and the effectiveness of the vaccine against the variants. And particularly one was mentioned, a variant coming out of Brazil.
Yeah.
So again, any knowledge we have on the effectiveness of the vaccines against these variants?
Yeah, so great question. So so a couple things to put the issue of variants sort of into context. Variants started hitting the news about a month ago, maybe 6 weeks ago. And that was because we finally started looking. But the reality is that these variants existed from day one. As soon as that virus made that jump from a bat probably to a pangolin. Go ahead and look that up to kind of find out what kind of animal that is.
Can I just tell you something real quick? I'm so sorry. My 6-year-old knows what a pangolin is.
There you go. Good.
I don't.
Good.
And I don't know if Dr. Google is either. Sorry, go ahead.
You got to look them up real quick. So again, it was probably the intermediate host that before it jumped to the human, that virus was already mutating and changing, and variants were coming about as soon as it started to spread into humans and get widespread transmission throughout the world. And so those variants existed, but we weren't really looking because we were too busy trying to figure everything else out. And those places that were looking, doing what's called molecular epidemiology, where you get the genetic material and you do what's called sequencing, and you look at the genetic material and see how it changes. And like every other organism, it's going to change over time. So what really became an issue is that the folks in the United Kingdom, which have the best sort of molecular epidemiology, public health surveillance that's out there, they identified some variants that were named, obviously, the UK variant, that may have been associated with more spread. The reality is that there was never any proof of that, and there's still not any definitive proof of what the impact of the variants are on transmission. Because, for example, people talked about the South Africa variant, but the rates of COVID in South Africa are plummeting like a rock. And so how big can the impact be? The reality is that it's something to watch. It's an important thing. It's something we're concerned about, that maybe there could be a mutation that can avoid our immune system and get what's called immune escape. That could happen theoretically, but that's not clearly what's been the case. Now, with the UK and with the South Africa variants, Moderna and Pfizer were both very effective. There is another variant coming out of Brazil called that's the P1 variant. That one got a lot of people's attention because it led to a lot of people getting sick and getting reinfected in Manaus in Brazil. But what's interesting is that there are a lot of other things going on in Brazil at the same time in terms of their COVID response. And they've kind of given us a run for the money in terms of maybe some of the biggest challenges with being able to mount a serious response against COVID as a country. And so that really kind of sort of muddied the water a little bit. But you heard it here first. I think an article is coming out in the New England Journal of Medicine tomorrow that says that Moderna and Pfizer are both effective against the P1 Brazilian variant. So again, that's another sort of little bump in the road that we're going to hit, but it just looks like it's going to work there as well. And that's all the more reason why, because these variants, it's theoretically possible that one of these variants or multiple variants will start to break out and cause us to have more difficulty controlling it with our own immune systems and the available vaccines. But there's no evidence of that yet. It's still unclear how transmissible, how sick they make you. But the bottom line is that that's why we need to vaccinate people now. That's why we need to keep wearing the masks when we're, in higher risk situations, and be able to continue to follow the guidelines as they exist. Because the less transmission, the less spread, the less chance for mutation, and the more chance we have to control and just end this pandemic. And that's going to be one of the key steps.
And I might have heard this from you. That's what I heard, that the best way to deal with the variants is, again, get out in front of vaccinations, slowing the spread, because the more it's spread, the more it has a chance to mutate.
Exactly. So, just stop it now. Just don't.
And by the way, I looked up a pangolin, and that is one weird looking creature.
It certainly is. Yeah, that is not.
That's amazing.
That is definitely. Kudos to.
Did somebody eat that? Is that how that? I mean, how do you?
They probably ate that with the bat, kind of a thing. So it's just very kind of interesting. So.
Okay.
Yeah.
We'll leave it there.
Yes, please. A couple more quick hitters here, and then I just have a few miscellaneous questions as well. But related to the vaccine, if I am vaccinated, can I still spread COVID or be a vector for COVID?
Yeah. So that data is starting to come out, and CDC is starting to kind of change some of the guidelines. You might have heard guidelines come out a couple days ago that when there's a vaccinated person with a small group of people who are low risk for infection, that it's okay to be without masks in an indoor setting, hence kind of the approach that we've got here right now. And that is the case. However, there's still ongoing studies looking at the ability of somebody who's been vaccinated to be able to spread. So not ready for prime time as of yet, but we are actually at UF looking to be part of a clinical trial looking at one of the vaccines that's going to try to address that very specific question, is that can people who've been vaccinated still spread to others despite the fact they've been vaccinated. So the data's starting to look good. Some of the experience that is out there is showing that maybe it's not as big a concern as we thought, but that data's starting to come together, and there are going to be some definitive studies and research projects to really address that.
Awesome. A couple more here on the vaccines. If I have already had COVID, should I wait to get the vaccine since I already have antibodies?
Oh, it's a good question, really good question. In fact, there's no real clear answer on that. My personal opinion, so the world according to Mike, I will say that depending on when you had it, I would say wait a little bit. And when I say wait a little bit, meaning May, not May 2022, but May of this year, you don't necessarily need to go to the front of the line. If you had it 6 months ago, 9 months ago, I'd kind of maybe move ahead and just get it. But I would get it only if you definitively had it, not that you had COVID antibodies. COVID antibodies, depending on where you go, are not very reliable. But if you had a positive test for COVID and or you were sick, or a contact and had a positive test, I consider that much more reliable evidence than having a positive antibody test. Not all antibody tests are created equally.
Okay.
And there's a lot of junk out there that are making people be able to pay for family vacations in the future because they're not. There's just a bunch of tests that we really don't know how to interpret, and they're just money makers.
Gotcha. Safe to go to the gym if vaccinated?
Depends on the gym.
Okay.
And depends on what you do at the gym.
Do you want to name some gyms? And this, I'm just kidding. I'm
wanna
kidding.
What are you looking for?
I
What
wanna-
were you looking for safety-wise?
So it's not so much the spraying stuff, because the spraying down stuff, and many times that's kind of what I call sort of hygiene theater. It just makes you feel good. But what I want to see is the number of people wearing masks, the concentration of people in there, and how, again, the use of masks and how many people get in there at any one time. And then also how much COVID is going on at that time in the community, because when you look at transmission and spread, gyms have been a place where that's happened.
Yeah.
And so it's just going to depend. So there's a certain gym in town, not one of the more popular ones, but one that is popular with the students, that, you walk in the door with a mask, you take it off as soon as you go in, and no one stops you. And so that's kind of a challenge.
Yeah.
So that's not a place to go unless you want to get COVID. So I think so. But I think that you've got to balance that with the fact, and again, this is where I'm going to kind of go against what had been the mainstream in terms of, you're either locked down or you're fully open, and that somehow you've got to fall on one side or the other. To me, it's you find the middle ground, because exercise is good for you. And in this time, it's really good for your mental health to get out and exercise.
Yeah.
And for some people, that means going to the gym. So be wise about it, be smart about it, but still try to engage in those things and use as many healthy behaviors as you can. So if you can't do cardio in the gym with wearing a mask, then try to do cardio outside, not wearing a mask. And you want to go to the gym to lift weights, try to do it with a mask on if you can, and do what you can with a mask, or go at a time when it's least crowded and wear a mask when you're not actually in the midst of exercising. So there's some things that you could do to sort of limit that and still get the benefits of going to a gym.
Got a text here from somebody else in our congregation who is a doctor, says the CDC is currently recommending 90 days post-infection before vaccination.
Yeah, and that makes sense. So again, that's something that we've been that has been kind of a moving target. So we've had some people that have come in to get vaccinated right after recovery because they said, my appointment came up, I want to go ahead and get it. And part of the reason why we recommend that, not just in terms of prioritizing people to get vaccinated, but it's that if you get it right when you're still recovering, that's a big hit to your immune system, and your immune system is pretty revved up. Yeah. And so many people have a recurrence of their symptoms and they feel like they got COVID again, especially those who've gotten more ill and a more allergic, not a more allergic, but a stronger immune response to COVID that first time. So we've seen that, especially with younger people that get vaccinated shortly after they've been infected.
Let's see. I got a few more pouring in at this point, so I'm going to try to get to them and also respect your time, Mike, because you've had a long day. If the vaccine provides immunity for a year, why is the CDC saying that you must quarantine after 90 days if you're exposed to COVID? So in other words, if you get the vaccine 90 days later, if you're exposed to COVID, you need to quarantine again.
They're super conservative. There's no data to say beyond that, so they're collecting data as we go along to see what the risk is in people who are 90 days out. So that's the data that exists, and so that's where the recommendations are. And the recommendations will sometimes lag. We want to push that back further. We're following those guidelines on campus in terms of if you've had COVID. So the translation was not post-vaccine, but it was post-COVID. Okay. So we just extended that to mean, well, if you got immune by vaccine, let's just use the same rules as before and then see what happens to that whole group of people. So I suspect that recommendation is going to change, but right now that is the current guideline in terms of the protection. And I think that's where maybe people got the idea that protection only lasts for 3 months. And that's just because that's what we know so far, and the CDC is very conservative, and that's going to expand over time. And so I expect as time goes on, the data is going to support just more and more opening up of what people who've been vaccinated can do.
Gotcha. All right, thank you. Last question about the vaccine. I think you've touched on this already a little bit, and then just some more couple of quick general questions. When can we expect to see the vaccine open to the general population? If I hear you and what you've been saying so far, you're saying hopefully soon.
Yeah. And again, a lot of that can be the world according to Mike and sort of wishful thinking on my part. I think that what I would like to see would be that it gets opened up to the general population within the next few weeks, certainly no later than early April, because I think that, again, an empty vaccine appointment is a defeat. Right, so you need to get it to everybody and just get people vaccinated. You don't want to break anybody's will, and keep the momentum going. Because I think until you start vaccinating 20s, 30s, and people in their 20s, 30s, and 40s, you're not having a big impact on the trajectory. You're stopping people getting hospitalized and dying. That's great. We need that, but we want this to end as well. So we're protecting people and we're protecting the population. So to do that, you got to hit two. It's not an either or. It's an and. And unfortunately, in our culture now, everything is either or. It's never and. And so for me, it's and. You got to do both, and you can do both simultaneously. So again, that's a lot of talking because I don't have an exact date.
Sure.
I'd love to be able to tell you an exact date, but my hope is that it'll be in the next few weeks. And I think you're starting to see that sort of start to trickle in, and hopefully we'll continue to see that liberalize more and more. But it's dependent on availability of vaccine and manufacture. We just heard that states are going to be getting 600,000 more doses per state here coming up shortly. So that's going to be a big hit per week. Fantastic.
Wow. 600,000 a week.
Yeah, more.
Nice.
Wow. Yeah, so that's going to be more that are going to be pouring into the state. That you're also going to be getting now that Merck has signed with Johnson & Johnson. They're going to really amp up. So they're going to be able to have enough vaccine for every eligible American plus a bunch more to be able to get vaccinated by the end of May.
Wow.
So again, there's going to be there should be 200 to 300 million doses by the end of May. And there's no reason why we can't be able to administer all those vaccine doses as we need to. So we are not far from herd immunity when we think about it. It's not that remote. We can get there.
That's really encouraging. Wow.
Yeah.
Just a couple of these other ones. I got a question. Any updates on treatments for long haulers? So this is not a question about truckers.
Yeah.
I'm sure you know the long haul term in this regard. So maybe explain that, and then also any updates on treatment for folks in that category.
Yeah, that's a big question mark. And there are a number of clinics and a number of different studies that are looking at that. For those of you who don't know, a long hauler refers to people who have long-term effects from COVID. So in other words, they recover, but they don't fully recover. They still seem to have symptoms. Their immune system is still battling with the virus. That is something that is increasingly being recognized. And doesn't really fit a pattern. We don't really know who or why. And so that's an active area of research. There's no known treatment as of yet. We don't really know or understand kind of how that works, and that's kind of an area of interest. There's a new drug that actually got a lot of attention that is an antiviral. It'll be the first, second antiviral drug that was actually fairly promising in what are called phase 2 studies. So in other words, it sort of showed some benefit and was studied in a small number of people and showed benefit and really was safe to take. It's got an unpronounceable viral name. I think it's like Ranuprilivir or something like that.
That's what I was going to say.
Yeah, I think it's Ranuprilivir or something to that. I'm sure I'm mispronouncing it. But that drug is going to enter into phase 3 clinical trials and may have a role with long haulers, but also may have a role in stopping spread immediately after people get infected. So a lot to be done there, and still getting new treatments is going to be key. But again, there are so many different efforts going on right now to get new therapies and to continue with other vaccine platforms that are going to start coming out here soon.
Awesome. Another one here, is air travel safe right now?
Yes, depending on how you do it and depending on where you go. So in other words, I traveled on a plane for the first time a couple weeks ago, and I wore my N95 mask. I felt very safe on both flights to and from. But again, just be careful. So in other words, wear your mask the whole time, wash your hands frequently. Whenever you touch things, don't do what I just did now, touch your face. And those things should keep you safe. I would still put off any unnecessary travel at this point, and then just travel as needed for now.
Okay. Yeah, we're almost done here, but you're probably tired of this. Sorry, this question I'm about to ask. So, effectiveness of masks. Still hearing some skepticism that masks are ultimately actually not effective and are sort of us giving into fear if we go out in public wearing masks. And I think in particular in the church setting, that there's this fear, this worry that we're giving into a culture of fear by asking people to wear masks if they're going to come to church here, which we do. So, your thoughts on that?
Yeah, I struggle a little bit with this at this point, because I think that the expert opinion and the data that we do have, with all its imperfections, but the data that we do have and the opinion of experts all points to the really important role that masks play. Before COVID, I wore a mask for a living. I mean, not like I'm the Lone Ranger or anything, but I wore an N95 mask in my day job with tuberculosis. And there's no doubt that masks work. They have an impact. And again, I was skeptical as far as the role of surgical masks and what they did, but the data that exists and the experience that is there is solid. It's very good. And so I just have to ask myself, if you're not looking at experts, who's giving you this information? And the overwhelming number of evidence, the overwhelming amount of evidence supports wearing masks. And what would be the motivation to have people wear masks if it wasn't scientifically sound or wasn't something that had some sort of public health benefit? I just struggle to understand what that is, and try to see that I can't see the scientific or public health or medical reason to doubt kind of the use of that unless there was some sort of agenda. So I have to confess that I do have some trouble showing grace answering this question, because it's something it's cost people's lives, and it is not based on facts. And I just keep asking myself when I'm up in the middle of the night, at what point did experts not matter anymore? It's just, where did that, when and how did that happen? So I don't look at it as it's a pandemic. 500,000 Americans are dead because of this. This is a serious thing. So when I'm in the ocean and I get out of the water because there's a shark, I'm not giving in to fear. It's just common sense.
Yeah.
If I'm getting on a plane and the pilot's drunk, I don't get on it. That's not just giving in to fear. That's, I'm avoiding a danger that's clearly there.
Yeah.
And I think when experts say, in the midst of a pandemic that's unprecedented in our lives and unprecedented in the past century, and they say to wear a mask, it's simple and easy enough to do, and as all the complications related to it, I struggle to think that you're doing that out of reasons other than science or medical opinion or just common sense. I don't understand it.
Yeah.
And so I want to be understanding of kind of the limitations and try to be humble in kind of the answer to that, and help people along to understand the impact. But I just don't know why protecting yourself and others during an unprecedented moment could be defined as giving into fear. I struggle with that. Just, I'm being honest and just being transparent about how I feel about it. I would be glad to have those conversations with folks about that, but I just don't understand. It's something that we know in the medical profession, that it saves lives.
Yeah, I appreciate your transparency on that, and I'm sure there's a wearing nature to this kind of thing, because like anything else in this day and age, it's become politicized, and it's not, as you said, based on the experts. And there's this great skepticism out there that, again, the wool is being pulled over our eyes for some reason. I'm not sure what the benefit is, but so I appreciate you sharing that. And I can only imagine, I mean, as a pastor, I've had some conversations, but this is your day job, and I imagine it's incredibly wearing to have to defend even one of the more basic preventative measures that has been shown to be effective.
And I would say that one thing that I've found that most people I would say everybody who denies the effectiveness of masks, what they all have in common is that they haven't been in an ICU filled with COVID patients. And so I think, and then to kind of hear the stories and read the stories of how they got to where they were, and kind of what led to them getting infected and what led to these things happening, I think that's there. And again, I say that wanting to be gracious and understanding and approach the question with humility, but I'm just being honest. It's after a year and change of doing this, I struggle to just still have that conversation.
Yeah, I can get it. Well, and you made a point, as a doctor, I mean, how many things do we do medically, surgeries, this and that and the other, the person's wearing a mask because you don't want to spread germs. And so, I hear you.
Yeah, it's not a stretch. It's a virus that we know is spread through the air from people who are infected, and many people who have it don't know they have symptoms, and wearing a mask prevents bad things from happening.
And I do, and as you said, I think some of the folks I've had this conversation with, when you ask them, they don't know anybody that's been really sick. and they don't have the experience. So it's hard for them to imagine that it's really as bad. But I remember early on having the conversation saying, they're shutting down countries. This is not the typical thing. So at this point, anyway, I appreciate your words.
Yeah, no, and again, just want to graciously help people walk through where we are and just try to understand where people are. But it's not, it's hard to argue if you won't accept the evidence that we have. And again, it's not just evidence that's published. We see it with our investigations that we do of cases on campus where we see, pairs of two people with masks and the risk of infection between two people with masks that were contacts, one with a mask, one without, the other one with, the other one without, and both without. We see the differences in infection rates between them. It's obvious. It's stunningly obvious, not just what's published, not what we're being told, but what we see on a day-to-day basis. It's not hard for us as people in the midst of this to really understand that. And again, there are many who will say, well, people are in those ICUs, they're dying of something else and get diagnosed as COVID. And we say that that's not true. They're dying from COVID, not with it, from it. And there are obviously some that die with it and would have died for other reasons. That certainly is possible and certainly does happen. But the thought of people not dying from this is just ludicrous. Just spend any time in an ICU, spend any time in a hospital, talk to any nurse, any doctor who's been on one of the wards, and that you will no longer, unless you just don't want to believe that person, you will no longer doubt that. This is real.
Yeah, Kim was talking to a friend of hers in public education, and she's got a lot of family in East Gainesville, and she was saying it's been devastating to her family. They've lost all these people of a certain age. She said, we're losing our elders. We're losing that generation. And so it's been, in certain communities, it's been devastating.
Yeah, yeah. I mean, if you're African American and you get COVID, you're 3 times more likely to go to the hospital and 3 times or 4 times more likely to die.
Wow.
So in certain communities, yes, it's a very big deal.
Yeah.
I appreciate your candor on that, Mike. So here's what I'm going to do. If you're watching with us still, I'm going to not take any more questions on text. I've got 3 here I'm going to ask, but we're going to go ahead and cut it off now because we've got questions pouring in, and I think we could stay at this all night. So, Mike, here's 3 for you, and then we'll just sort of wrap things up. I do have one more date prediction question I want to ask you.
Good.
I
could be wrong about something else.
Yeah, that's it. Yeah. Here's one from the text here. I tested positive, no symptoms, and quarantined for 10 days. If I test now, will I be able to test negative? Only PCR test, or is rapid test good? I'm assuming this has to do with the international travel question. But
yeah, there's no need to test again unless you're going to travel, and you need to show a negative test to travel. But after you recover, you don't have to test again. Some people stay positive for a long period of time after they've been positive and recover. The positive PCR test does not mean that you're still infectious. It creates problems for people who want to travel and need that negative test. And in those cases, test until you get a negative test and then travel. But it's a difficult one.
And the PCR test better than the rapid test?
Yes, it's better in many different ways except for turnaround time for certain circumstances, but it's more accurate and a better test overall. And to my understanding, most travel does not, they require PCR. They will not let you travel with a rapid antigen test.
This one asking about what I believe is a medicine, ivermectin.
Ivermectin, yep.
I was close, Steve.
Yeah,
that's pretty good.
You thought I wasn't going to get it. Tell us about that.
Yeah, so that's a commonly used medicine that actually recent studies have looked at it. And again, I have to claim ignorance because there was a recent study that came out related to that I haven't seen the results. But what I understand is that it was disappointing and didn't really show any clear benefits. But you got to take that one with a footnote. I got to double check that to be sure. But it hasn't been sort of the thought that would be a way forward, and it does not appear to be the case. But that's one I'm going to put an asterisk by. I got to double check that to see the most recent stuff.
Last question from text here. I keep seeing articles about, quote, excess mortality numbers. Can you comment on that?
Yeah, so essentially, I think what that question is referring to is that when the pandemic first started and a lot of people were getting diagnosed, and there were some people asymptomatic, and there was question, and some people started to doubt the number of people that were dying of COVID. And there wasn't any definitive evidence at that time. So sometime in the fall, I forget when it came out, but there was a data that looked at it. And at the time, I think the U.S. had about 200,000 people that died because of COVID. And then they looked at mortality statistics across the U.S. over that time. And clearly, if there was something new that caused people to die, then you would expect there would be at least 200,000 more deaths than what would have been expected.
Right.
If they were just dying with COVID and dying, nothing new would really change. They just got diagnosed with something new and we're calling it something else, but they're just dying anyway. We would then say, well, there would be no excess deaths, and then the excess deaths would have been at zero. Well, actually, what ended up happening is that when they looked at those statistics at that time, there weren't 200,000 people dead, excess deaths. There were 300,000. And so that extra 100,000 deaths came from the effects of the lockdown. So in other words, people stopped going to the doctor. There were more suicides. There were more homicides. There were more accidents where people didn't go in and get medical care. There were a lot of other causes of mortality that occurred as a result of COVID that weren't COVID infections, because really pretty much if you get that sick and go to the hospital, we're going to diagnose you. But these were people that were dying from other things. It was a result of society kind of having its problems. So in other words, pandemics kill in three ways. They kill by ravaging an individual's immune system. They devastate economies when you go into lockdown. And then third, they tear away at the fabric of society that don't allow us to do the things that really keep us healthy and functioning and doing what we need to as a society. So those excess deaths were real. And there are a lot more people that died as a result of the pandemic that were not directly deaths related to the virus itself.
Yeah. All right. Appreciate that. Two more, and then we're done. I promise.
Sounds good.
Here, let me just ask you a couple of date prediction questions, and if you could put a time of day in with this
I'm
too,
gonna
this would
do it.
that would be really helpful.
Yeah.
If the current trends continue, when do you expect we'll be back to normal?
Back to normal. So the pandemic is going to have a tail. And so that tail is going to probably last. We're planning for a tail of at least 6 months on campus to say that we start getting back to normal over the summer. We start probably filling to capacity different venues and different things in the fall, depending on what the numbers do. Will mean masks versus no masks. I'm hoping for no masks. If we successfully vaccinate people and no weird variant comes that undermines where we're at, or that somehow I was wrong and that the vaccines don't last as long as we believe that they will and the data was all wrong as well, things go really sideways. But if things go as projected, I think that the summer is the transition point. Much of that transition is mental. Going to be like, gosh, I'm really next to a bunch of people without masks on. I don't know how many are vaccinated, but there's been 4 cases in Alachua County, so I think I'm good. So again, it's going to be that sort of mental thing to kind of transition, but I think that'll happen over the summer. And then by fall, we're going to be deciding, depending on the rates, depending on how well we handle the vaccination effort now, that we will be set. Now, there'll still be cases of COVID. There are going to be people that are amongst those who are more vulnerable and who didn't get vaccinated. There are still going to be some outbreaks. They'll be small. But again, remember, with the vaccination efforts that we get, there are a lot of dead ends. So more dead ends to the virus, less chance for a big outbreak, less chance for surge. So I'm looking at a normalizing summer with periods that are going to be really looking very normal, and then a fall that starts to look very normal depending on how well we do with the vaccine effort.
Okay.
And probably, so I would say August 3rd. No, I'm just saying. So anyway,
So you didn't give a date.
I didn't give a date or a time,
That's
but
frustrating
but
because I asked you for that.
Yeah, but a little bit later, maybe I'll kind of be tempted to do that.
Oh man.
Yeah.
So I'm hearing you say get the vaccine.
I'm saying get the vaccine.
Get the vaccine.
It's good for you as a personal health issue. And then if people always want to say, how can I do my part? This is the way in which you can do this part. And it's protecting not just you, but others around you and others who are going to be more vulnerable because you become a dead end.
Yeah. Love it. Okay. And then related to that, again, a date and time question. When will we be able to sing at church without masks?
It's same thing depending on the vaccine. So I'm hoping that will come soon in this summer. My hope is that it's going to be sometime in the early summer. And again, if the vaccines are available and people get them at the rates that we have, we should see big drops in the virus right now. We're plateauing right now because we're not focusing on the groups, or not able to focus on the groups that we need to. So in other words, there's not enough vaccine available. We're still not going into those transmission groups, those age groups that we need to. But as soon as we do that, there should be a big dip that we should start seeing sometime in late April. And when that happens, that's the sign. And then at that point, we're looking at June. That's my hope.
Yeah.
And it's hope, and that's the world according to Mike.
Yep.
There is no modeling that's there, and this is just all subject to change. But that's kind of what I'm hoping for, that somehow we start to see that big transition to normal in late May, early June.
I want to live in the world according to Mike, by the way. Steve, any last questions before we wrap this up?
I'm still thinking about hygiene theater. So anyway, I'm going to use that term.
That was a great term.
That was a great term. So, two questions. One, what is something out of this whole year which has just been crazy? What is there something that's been encouraging to you?
Yeah, there's been a lot that's been encouraging. I mean, I think that I'm just going to put it all out there, but I think that what's been encouraging is a lot of the relationships that I've been able to form. And then I would also say that to be completely honest is just, I think that it took a pandemic to get me to worship with my brothers and sisters on the east side of town.
Yeah.
Wow.
And just realizing just how many, what a connection there is.
Yeah.
And it's, again, I don't want to, when something like this happens, you don't ask why, but I think the question is what now? And I feel like I'm, forging, real relationships there that are not just pandemic related, and that I think it's important. And I feel that I've been impoverished because I never really thought about it before.
Yeah.
And I feel that I've lost something because I didn't think of that before. But now it's like, hey, look what I found. And so to me, it's a really good thing. And that's just among many other things as well. I think it's the relationships, the importance of relationships, the importance of which relationships really matter. I think the bigger picture is the importance of communicating and listening, the importance of just kind of looking out for one another, and just the need for grace. I've been more wrong this past year about things than I've maybe ever been, and just learning to kind of accept that and kind of just keep trying and just to try to approach things with humility, because I'll be humiliated here in any moment. But I think the goal is just to keep trying.
Yeah, I appreciate that, Mike. And again, hopefully one of the side benefits of this is we do come out with some really sweet, deepened relationships in the community, especially among the churches, that will hopefully bear some really sweet fruit. The other thing, and because you and I are involved in another project, Care Grace, since you're on this, just to say you're going to have a fundraiser. Care Grace Foundation is having a fundraiser in June. So things with children's cancer in the DR are going really well. So
they're going very well. Yeah.
Along with dealing with the worldwide pandemic, you and Eileen are still pushing the ball down the field on childhood cancer in the DR.
Yeah.
So thanks for all that.
Yeah, things have been going well. That trip I took by plane was a necessary trip to go down to the DR related to that. And again, it's just very encouraging to see how it's been working there. Through a very generous gift, we got a lot of personal protective equipment, or PPE, to protect the kids. The kids did extremely well throughout the pandemic.
That's
it's still
fantastic.
Kind of an epicenter there. There's still pretty high rates, but they've done really, really well. And so, by God's grace, we'll keep trucking on and keep going. So really excited and starting to plan and think for a post-pandemic world, and kind of how we start adjusting ourselves in terms of how Cure Grace will kind of react to that, and kind of how we'll start moving forward with expansion into Brazil and Colombia like we had planned before.
Yeah.
And just don't hopefully not miss a beat. So just we hit the pause button for a year, and so okay, all right, let's move on. So I'm excited, and also by God's grace, we had our most successful funding year ever last year.
In the middle of
a pandemic. Yeah. So again, I think we're very encouraged by where this is headed, and again, we'll just kind of keep moving forward by God's grace, and use what we've learned to keep pressing on.
Mike and I are proud to call you friend. We're grateful for your work. A whole nother broadcast on faith and vocation and how they tie in. You are the poster child right now.
Yep.
But that'll take another hour, and we won't do that. So thanks for your time, brother.
Problem.
We love you, and they're grateful for you.
No, thanks very much. I hope this was helpful. I mean, I think there were some more challenging topics in this conversation, and again, I try to do that with as much grace. I think the thing I prayed for before coming on was just for grace and wisdom to kind of be able to communicate fairly and honestly with kind of what's there, and then to help people make the best decisions that they can, because some of these decisions are not easy. That's something that we overlook, is that none of this is easy, and there are no easy answers. And if anybody's telling you easy answers, it's like, hey, you need to kind of get some other advice, because none of this is easy or straightforward, but just together we're stronger. Together we'll get through this, and together we've got the tools to be able to move forward and do this, and to care for one another, and use what we've got available. So just want to keep encouraging one another, and please keep encouraging me. I appreciate that. But I think we'll be able to kind of keep making a difference here and pushing forward.
Amen. Well, same thing, Mike. I'm really thankful for the time, and thanks for making time and space for us tonight. Thank you for all of you who joined us on YouTube and sent in your questions. Really appreciate you being with us today. If you'd like more information about the church behind this podcast, you can visit our website, creekside.com, or download our mobile app by searching Creekside, Florida, or Creekside FL, wherever you get your mobile apps. We're back next week with our regular episodes and a great interview with former Creekside pastor Ryan Fields. You're not going to want to miss it. Until then, stay safe, listen to the experts, wear your mask, and when you are able, get your vaccine. We'll catch you next time.